5 things I wish I knew before leaving bedside nursing. I'm going to be sharing lessons that I learned during my transition where I tapered down from the bedside and tapered up with medical writing, so you guys aren't as lost as I was. Let's dive right into it. So the first one, I wish I knew I would be welcomed into a different community. I think so many of us hold nursing as our main identity. We are nurses, RN, LPN, NP, whatever your license is. We love that. You know, so many of us call it a calling. I see license plates that have nurses. I see sweatshirts that have nurses. No one understands nurses like nurses are because we've lived so many weird, fascinating moments. And a lot of the time we can't talk about it with other people, either through HIPAA because of confidentiality concerns, or because the people just won't understand, or it's too gory, or they don't want to hear it, which I understand all of that. So a lot of the time, we're really bonded to this community of nurses because they're the only people that understand us deeply in this area. So it's really intimidating to leave that sense of community that we've built, especially if it's been decades. So it can be really scary to dive into the unknown. I think nursing is also really tough though, because a lot of nurses think that we're less than. I hear the term all the time, just a nurse, or real nursing. And I try so hard to push back on those labels. There is no thing as just a nurse, and there's no thing as real nurses. If you have an RN or any sort of nursing degree and an active license in your state, you're a real nurse. And just because we are not providers does not mean that we have to put just up before our name. There's no other industry that does this, so why do we do this? Occupational therapy doesn't do this. Physical therapy doesn't do this. So why are nurses always putting ourselves down for what we don't have? Instead, we really should be focusing on what we do have. So because we're such a close-knit community, but at the same time, we're so catty with each other, and it causes this deep sense of like inferiority and that we need to be working, you know, either at the provider level or at like an acute critical care level in a hospital to really matter. We have this like really weird complex going on here. We can practice outside of the nursing community. And I was so surprised when I pivoted away from the bedside, and I don't think I realized, well, I did realize how toxic it was, but I don't think I realized that not everyone is as toxic as that. Like other industries aren't going to treat me like that. And that made me feel a lot more welcomed and a lot better when I transitioned away from that community into a different one. As a nurse, you're a field expert. So people are really, really excited to have you on their team. You're not hearing terms like just a nurse or real nurse. You're hearing terms like field expert and just your credentials. No one cares, which was really, really refreshing to see. So we're held in such a high regard when we enter the medical writing world that I was so taken aback. Sure, it's not the community that I'm used to, but it was a healthier community. It was a much, much healthier community that just welcomed me with open arms. So I think I was really scared to leave because I didn't understand what leaving meant, but I was really happy when I did it because my opinion was valuable. I mattered for the first time, and I wasn't a prescriber, and I didn't even work in a hospital. I never have. So it was a really surreal moment to me that people weren't putting me down for my lack of experience, my lack of titles, that they were building me up, welcoming me into these conversations because I was a field expert. So that's a huge transition that took me a really long time to get used to. And I really wish I knew that because I think it would have made me a lot more open to the idea of leaving. I probably would have made the transition sooner. The second thing I wish I knew when I was transitioning away or to a limited capacity from the bedside was that I wasn't leaving nursing. Just because I wasn't touching a patient didn't mean I wasn't a nurse anymore. I still have an active nursing license in my state. I'm going to read you the definition of nursing from American Nursing Association, and it's our scope of nursing. I think this is so important because everyone has a lot of opinions about what a nurse is, what a nurse isn't, that I'm not a nurse because I'm not touching patients. So this is what our governing body calls nursing. So nursing integrates the art and science of caring and focuses on the protection, promotion, and optimization of health and human functioning. We prevent illness and injury, facilitate healing, and alleviate suffering through compassionate presence. Nursing is a diagnosis and treatment of human response and advocate in the care of individuals, families, groups, communities, and population. It says nothing there that I need to physically administer a medication, that I need to physically touch a patient, that I need to be in a clinical aspect. If anything, there's some things that medical writing is really related to, in particular that we are advocating for population, that we're promoting the optimization of health and human functioning. So again, it says nothing about remote work, clinical work, bedside work, anything like that. That's something that biased nurses come up with because they have one perception of nursing. Nurse managers are still nurses, and I never see them touching patients. Same thing with a lot of other roles of nursing. Some admission nurses, some community health nurses, vaccine nurses, research nurses, a lot of them don't provide clinical care. So the fact that nurses only working in hospital, it's a really narrow focus that I wish I understood and that I wish other nurses would understand. When I was first contemplating shifting my focus from the bedside to a remote work, I was super concerned because nursing is an identity for so many of us, including me. We're nurses. We're always on. If someone needs us, we help. So what does that look like when you take away the manual labor? It just means that I can help more people. I've been on the team to get drugs and medications manufactured that have helped thousands. My blogs about diseases have educated more patients than I ever could at the bedside. Because I didn't have time at the bedside to do what I wanted to do, what a good nurse does. Because I took away that physical touch, I'm actually able to help more patients. So I invite you to really broaden your concept of what a nurse is, because it can really change. The third thing that I wish I knew as a nurse leaving the bedside is that nothing is forever and there are no absolutes. As a nurse writing coach, I hear this from my students all the time. I think a lot of nurses are all or nothing, especially because we're so trained in that mindset at the bedside, right? We're looking for trends and we're analyzing things in that type of thought process. We also want to be the best nurses ever. And to so many, that means working in a hospital on an acute floor. It doesn't mean working remotely as a writer. And because of this mindset, so many nurses are worried about leaving bedside, even though they aren't really leaving. They're just practicing in a different capacity. It's a different niche. It's a different subspecialty of nursing. I coach nurses on how to leave the bedside and become successful writers. And so many of them are worried about leaving the bedside. I tell all of them, you can go back. I promise you, they will take you back with open arms. And you know what? If that job doesn't take you back, there's a million jobs. Nursing jobs are a dime a dozen. You are not missing out. If anything, you're missing out on not trying this new facet of nursing, this subspecialty of nursing. Clinical bedside is not going anywhere. We're in a shortage and we're going to be in a shortage for a long, long time. So that means that the job market is going to be strong for you. You can stay at a limited capacity at the bedside. You don't have to quit to become a writer. You can do it per diem and per diem. You can write in your part-time. You can work full-time at the bedside and write a blog a week. Again, you don't have to do all or nothing. It's up to you to create your own happiness, and I think a lot of nurses get caught up in that. There are no rules in life. You can do whatever you want. So if you're super concerned about leaving your job and shutting the door on nursing forever and that you won't like medical writing, I invite you to give it a try. If it doesn't work, run right back to your clinical job because I promise they will love to have you back. They are dying for nurses everywhere. So the fourth thing that I wish I knew as a nurse making the transition to a medical writer is the unknown doesn't have to be scary. Just because we don't understand what is on the other side doesn't mean it's bad, doesn't mean it's less than what we know right now. A lot of my writing students are terrified to leave the bedside again. Nursing is their whole career and a huge part of their personal identity. Most of them refer to it as a calling. So to suddenly shift their whole persona into a different perspective is difficult for them, even though medical writing is just a different type of nursing. It becomes especially intimidating when we talk about going into a specialty that they're completely unfamiliar with. I don't know about you, but I didn't know a single medical writer when I made the shift. There's not a lot of us, which means it's a really good market right now. So I think a lot of nurses are scared of the unknown, but we also didn't know about nursing when we started, right? I know I didn't. I had an inkling, but I didn't know a ton about it. So just because we don't know what's on the other side doesn't mean we need to shut it off completely. And it doesn't mean that, like I said before, it's that all or nothing. The fifth thing I wish I knew when I was transitioning from the bedside to a medical writer is that I can absolutely thrive in a different role with transferable skills. I didn't understand nurses had so many skills that make us amazing writers. Sure, we're not going to be doing G-tube feeds as writers, but we will be doing prioritization, and we will be looking for accurate information, looking for the best practices. And it's the same thing when I transitioned from being a waitress to being a nurse. I had no idea how similar those were. And I consider nursing to be waitressing just with medication, right? The same things are true there. Prioritize accurate time management and keeping your client or your table. So medical writing is really the same. And a lot of the reasons you were successful as a nurse are the same exact reasons you're going to be really successful as a medical writer. I did an entire video on transferable skills that you'll need as a nurse and a writer. So if you guys are interested, make sure you like, subscribe, and follow because it's really informative. If you guys need more help on that too, I offer a course at willowbarkwriting.com. It's a writing academy. We have workshops, coaching, and the course, it's an all-encompassing thing to support you in your transition. But I wish I knew how useful so many of those skills were. Those heavy med passes would help me for juggling multiple deadlines, deliverables, and clients, and how my keen sense of trends would serve me when I was looking for research for my client. It's super wild how similar these two fields are, and I wish I understood that when I was making the transition because I thought that those were completely different things.